Hello friends, today we are going to discuss about inguinal canal, and I guess this is very important topic, and many students find it difficulty during its understanding from our normal books of anatomy. So I am coming with this topic with bit easy pictures of anatomy picture of inguinal canal, and I will discuss about the its boundary and content and what is about spermatic cord, everything. So for its sake of understand, suppose this is the superficial inguinal ring at here, and this is the external oblique okay, and suppose this is the inguinal canal. This is the superficial inguinal ring, this is the deep inguinal ring. Okay, so SIR is equal to superficial inguinal ring, and DIR is equal to deep inguinal ring. Okay, and this is about the internal oblique. I am just write about IO. Okay, and this is the transverse abdominis. Okay, and just behind it, this is the fascia transversalis. Okay, and ultimately this is the fold of peritoneum. And you know the testis structure during its embryonic life, it is above than the not deep inguinal ring. So during its descent from the lumbar region, it is, suppose this is the testis, so during its descent it's come through this with peritoneum, then through deep inguinal ring, so its covering is according with it. Okay, so we can easily see when you talk about its boundary, suppose we just make it like this, and this internal oblique and transverse abdominis, this form is, this is about the roof. Okay, then this is the conjoint tendon. Okay, as simple as that, conjoint tendon. And here about there is a small reflected part of inguinal ligament. So I think this is as simple as about its boundary. So you can easily say about that, firstly about the boundary. Okay, so firstly about the anterior wall. So anteriorly, what is this? Obviously this is anterior, and because some part of internal oblique is also at the anterior. Suppose we look at, this is an anterior, this is the posterior. So obviously anterior external oblique, so obviously fully, and internal oblique, and obviously this is the lateral portion, suppose, and this is the medial, so we can easily say the lateral portion, laterally, okay, laterally internal oblique at the anterior. When you talk about the posterior, you can easily see this is the posterior, that is the fascia transversalis, fold of peritoneum, okay. But when you talk about the as it's better to like that fascia transversalis, and obviously posterior is the conjoint tendon and some part of the reflected part of inguinal ligament. So fascia transversalis, fascia transversalis, okay, and obviously conjoint tendon, and obviously a reflected part of inguinal ligament, okay. And you can see about the roof that is formed by this is the thing, roof, okay. So roof is by fibers of internal oblique with transverse abdominis. Very very important that transverse abdominis is not forming its anterior boundary, it is outside, okay. And obviously ultimately the floor is by the inguinal ligament, and you know about inguinal ligament, it is the continuation of the external oblique aponeurosis, inguinal ligament, and some part of lacunar ligament. If you want to know how it is like lacunar ligament, very simply, suppose this is the anterior superior iliac spine, okay, and this is about the pubic tubercle, okay, pubic tubercle. So this is the thing like this is the inguinal ligament, okay. But in this inguinal ligament you have to know there is this portion, okay, this portion is the lacunar ligament, and then it forms the, here there is a Cooper ligament, Cooper, okay. So this is about the inguinal ligaments topic, and this is our whole of the inguinal canal boundaries. I think there should be no problem. And next you have to know about the its content. This is also very very important. In case of male, there should be spermatic cord, ilio-inguinal nerve, but incomplete, okay. I just write, then I will explain how it is. In case of female, this is the round ligament of uterus, and here also ilio-inguinal nerve, but this is also incomplete, okay. And here I will want to discuss why I call it as incomplete, because suppose this is the testis coming through the deep inguinal ring, then through the inguinal canal, and then coming here, so it is totally there is, and but in case of ilio-inguinal nerve, it is come from here, so it is not coming through the deep inguinal ring, so we will call ilio-inguinal nerve as incomplete content of inguinal canal. And next is about the spermatic cord. It is also very important. Spermatic cord, just remember the contents are content as 3V. V for egg, V is vein, that is the pampiniform plexus, testicular vein. V for vas deferens, okay. V for vaginalis, that is the processus vaginalis. Okay, processus. And next is about the 3A. Obviously A for artery, that is the one is here, testicular, that is the testicular artery. Obviously in vas, that is the artery to vas. And obviously cremasteric artery. Cremasteric artery. Next is about the 3V and 3A, then the others. And it is the genitofemoral nerve. Genitofemoral nerve. Autonomic nerve. And lastly, lymphatics. Okay, so this is about the content, and I will just lastly I will talk about the when the testis is through the peritoneum and through the deep inguinal ring and through the external oblique aponeurosis, and it is about aponeurosis better, not muscle, aponeurosis. Okay, and then it is through the superficial inguinal ring. So testis is covered by many layers like peritoneum, and through the deep inguinal ring when it is the fascia transversalis. Transversal means as it is outside, so it is not forming any boundaries, any coverings, and also internal oblique is here, and ultimately the external oblique. So you have to know about the coverings, and this is I think about the last topic from here, that is the coverings. It is also very important for any exam, covering of testis. So I will simply talk external spermatic fascia. As simple as this is by external oblique. Okay, middle में cremasteric fascia. This is by the internal oblique. Internal spermatic fascia. By the fascia transversalis, and ultimately the tunica vaginalis, that is by peritoneum. Important that transversus abdominis not forming the covering. And ultimately, suppose a clinical based question, that is, suppose this is the rectus abdominis muscle, okay, and this is about the pubic symphysis. So this is the this is the inguinal ligament, and here the inferior epigastric artery, which is a branch of external iliac artery. If any inguinal hernia is coming through here, this is called direct inguinal hernia, that is medial of inferior epigastric artery, inguinal hernia. But if it is coming from lateral, from this region, then it is indirect inguinal hernia. Okay, so this is about the basics of anatomy. I am not going to the details of inguinal hernia. It will, if I have time, I will discuss in the next topics. So thank you friends, just go through this. Thank you.